Here at Maui Derm, in my sessions, I primarily talked about pediatric genital skin conditions. These cases are particularly challenging because you not only need to know which medications to use, but also how to approach these very sensitive exams. It is very important to always ask the child for permission, and it's important to let them know that this exam can only happen because you are their care provider and their parent or guardian is also present. It is important to know normal anatomy and changes that can happen over time with puberty. If you don't know what normal is, it can be hard to pick up subtle diagnostic clues that can help you when a child comes in with a genital complaint. One of the most common complaints I see in my pediatric practice are girls that come in with vulvar dermatitis due to contact with urine. In our session, we reviewed vulvar hygiene practices, anti-inflammatory medications, and barrier products that can be used to help these patients. We all know how to care for pediatric lichen sclerosis, but where most of us struggle is what to do in the maintenance phase. In our session, we reviewed standard of care for pediatric lichen sclerosis, including best practices for what to do when the child is in remission, which essentially is treating them for at least a minimum of 2 years and then making sure that they have appropriate long-term follow-up. We talked about pediatric genital psoriasis and medications that are FDA approved for our children with psoriasis. And very importantly, we talked about genital warts and when you need to think about and report any concerns for abuse.